Our next speaker is Dr. Patrick McManamon, who's going to talk about two coexisting conditions that we often have to juggle, with can be sometimes fairly complex and challenging, and that's managing glaucoma and dry eye disease. Dr. McManamon is the Medical Director of Medical Optometry America. Patrick, thanks for coming, please.
Good afternoon, everybody. My name is Patrick. Thanks for coming. I'm sorry? Could you hear me? Okay. So I'm an optometrist not too far outside of the city of Philadelphia, out in Plymouth Meeting. And I work alongside ophthalmology pretty frequently, managing glaucoma. But I also like to take on part of the burden of handling dry eye disease in our glaucoma patients. So when we talk about dry eye disease, it's a little bit of a complex question and a complex answer. The surface of the eye is a delicate balance that tends to get angry very easily. It tends to get angry depending on a lot of our environmental factors that exist. So any disruption in the surface of the eye can cause blurred vision, watering, scratching, feels like something's in there, like an eyelash or a piece of sand or a rock, any of these types of things. A lot of redness or just the sensation of dryness. And that develops because of a disruption in the amount of water and oil that we have in our tears, which are supposed to be in a delicate balance. And our eyelids behave like a windshield wiper. So when on the surface of our windshield, if there's a little bit of water and you hit your windshield wipers, it sort of smears the vision, or you might get a little squeak. And the same thing happens on our eye. If we don't have quite enough fluid, we end up with a squeaky eye, which is uncomfortable and sometimes blurry. So as eye care providers, when we look at a dry eye, we sometimes see sort of like dry skin that we can find on our hand. It feels rough and it looks rough on the eye. We see little, what we call punctate keratitis, little dots or flecks that are in this image, if you can see those at all. That's basically little loss of the skin on the surface of the eye, and it can be very uncomfortable. Whenever you blink over top of that, it feels scratchy. When you look through that, it looks very cloudy. Sometimes we see redness of the conjunctiva, the white part of the eye. This redness can come from blood vessels being swollen. It can be a sign of irritation, inflammation, infection in some cases. And it can be sometimes cosmetically bothersome. No one wants to look in the mirror and see red eyes. I sometimes joke with my patients when they come in with very red eyes that they have to wear red clothing to make sure that they match. So when we manage dry eye disease, just from a big picture, we try to reestablish the balance of oil and water on the eye and make sure that our tears are working correctly so that our eye can stay comfortable and so that our vision does not fluctuate. That allows for the skin of the eye to heal, and we try this with a number of different things. You probably have heard your eye doctors talk about warm compresses, artificial tears, and all of these types of things, which are all excellent strategies in our toolbox and things that I recommend every day of the week. And they all have their place and their purpose, but we sometimes have to try to balance our glaucoma treatments along with our dry eye treatments. We like to treat the eyelids because that's where the oil component of our tears comes from. We call it meibum. And so we recommend the compresses. I often recommend mineral oil eye drops to help supplement that. We have prescription drops, sometimes oral medications, and there are some diet components as well. If we need more water in our tears, we add water. Sometimes that's with punctal plugs if you've had those or had that recommended to you. We have prescription drops for that, or just over-the-counter drops that everybody's familiar with. So I get the question pretty frequently, does glaucoma affect my dry eye? And usually the answer is not directly, but again, we have to balance these things together. So sometimes our topical medications, when you instill a medication, it can sting, it can burn. While that may not be inducing dry eye, it can cause some disruption in the surface. Now, we know we need to treat glaucoma, but we also want to make sure we keep eyes comfortable, because when eyes are not very comfortable, or if drops are causing issues, then our compliance tends to go down. And we know that in approximately 50% of glaucoma patients, we see dry eye complaints and symptoms. It's almost not quite ubiquitous, but it's all over the place. In a normal standard population, we see dry eye in about a third of patients, so we know it's higher in our glaucoma care. We try to figure out different solutions to make you more comfortable. So number one, talk with your doctor. I know many providers who are both dry eye specialists and glaucoma specialists who will handle all of these things together. Some doctors would be more comfortable managing glaucoma and having a separate provider managing dry eye care. I think that's totally reasonable. I think it really depends on your care team and who's available to help. Sometimes that's available in one practice, sometimes it's a couple of different practices. But dry eyes can be extremely uncomfortable. The term dry eye sounds almost like it's minimizing the condition. And sometimes we like to talk about it as ocular surface disease, but really it can dominate somebody's life. I have patients with very uncomfortable dry eyes in the way that, you go for glaucoma visits, patients come in for dry eye care all of the time. And when you have to overlap those things, it's a bigger deal altogether. So we try to manage all these things to make sure you're comfortable, but while we're also maintaining your glaucoma management. So one thing we always look for when we have difficulties with our treatments is that there are other treatments available. And I'm not going to dive into all of those because I know that they've been covered today. But sometimes our topical eye drops beat up the surface. That can be from using multiple drops. And we do have preservative-free formulations, both from some of the big pharmaceutical companies as well as from some of the smaller compounding companies. We have obviously SLT, which has probably been spoken about several times today. We have incisional surgery, other laser procedures, all different tools in our toolbox, again, to make sure that whatever our treatments are hopefully not making backwards progress in our dry eye and our comfort. Sometimes I have patients who come in and say, well, my glaucoma drops are the problem, and I suggest, well, let's try other drops. And it feels almost goofy to be treating drops with drops. It's like treating fire with fire. Although they have totally different mechanisms and we want to use those differently, it can feel like a goofy solution. But sometimes it is our best solution. It can be annoying to put in extra drops throughout the day, no doubt about that. But we try to make sure that whatever effect we're having from a glaucoma medication or treatment, we can try to counteract it so that you are comfortable and so that we can make sure we can get the effectiveness from the glaucoma drop and still make sure you're seeing well and handling your corneal comfort. So for the most part, it's a team effort. We want to make sure we have this delicate balance, both on the surface and in our overall control of the ocular surface and the optic nerve health. So we know we need to try to bring the pressure down. I actually learned a couple things about exercise in our last speaker to know that we have different options to try to control our eye pressure. Certainly, if you're in excellent cardiovascular health and that improves your eye pressure, that's probably going to only help your dry eye as well. So a lot of this will come down to the balance of your surface and the pressure and your doctor-patient relationship. So if we need to change or alter treatments, we have that available to us sometimes, and sometimes we don't have other treatments available. We've tried all these other things, in which case we need to try more dry eye treatments. That's all I got.